From the leagues of women voters of Akron area, Greater Cleveland, Hudson, and Kent, this is Real Talk. Thank you for taking the time to be with us this evening. For those joining us and needing closed captioning services, they are available. Follow the instructions seen here, highlighted with the arrow, and we will leave this screen up for just a bit. Real Talk is a diversity, equity, and inclusion program hosted by those 4 leagues of women voters in Northeast Ohio: Akron, Greater Cleveland, Hudson, and Kent. The program addresses issues of discrimination, racism, oppression, and suppression across Northeast Ohio, touching on topics from education to health, to employment and housing insecurity, to criminal justice, to environmental injustice and democracy. In this program, we'll be hearing from leaders, state, county, and city, who've long named racism as a public health crisis. I'm your moderator, Rick Jackson of IdeaStream, the public media outlets for Northeast Ohio, including WVIZ-PBS, 90.3 WCPN, and 104.9 WCLV. We would also like to thank and credit the Akron NAACP, a longstanding friend and partner of the league, and a prime builder of the program we are presenting tonight. Please note that the resources we will be mentioning throughout the night will be emailed to registrants later, and that this session, like those previous, is being recorded, enabling you to go back as needed and review what we'll learn tonight. It'll be posted at realtalklwv.org. The American Public Health Association tells us much about racism, that it may be intentional or unintentional, that it operates at various levels in society, that racism is a driving force of the social determinants of health and is also a barrier to health equity. We've seen examples of communities pushing back. Cleveland, Akron, and Cuyahoga County are among the Ohio entities that have made the definitive statement that racism is a crisis. So too have Columbus, Dayton, and Youngstown. But cities that make that declaration can't just stop there. They are required to eliminate disparities in public health. And acknowledging racism puts a name to the problem and creates methods to hold leadership accountable. So tonight, our leaders will inform us as to why they would prioritize the health and safety of communities of color and how they would engage entire communities to dismantle the systems, infrastructures, and belief systems that perpetuate systemic racism. What's their message about the impact racism has and the impact they each hope their leadership is having on Northeast Ohio? Before we get to our panel, each of our guests will offer a take on the issue. Our opening remarks come from the Ohio House Minority Leader, State Representative and Democrat Amelia Sykes of Akron. She's an Akron native, first elected to represent her constituency in 2014. Among her passions in the State House, Leader Sykes has pushed an aggressive job creation plan, fighting to keep local jobs for local workers and to expand opportunities for middle and working class families in Akron. She is a proponent of a quality education and job training for people to get ahead. She's currently a co-sponsor of resolutions HCR 6 and SCR 4, which died in the General Assembly last year. Leader Sykes attended Kent State University, graduating magna cum laude with a BA in psychology. She later attended the University of Florida and earned a Juris Doctor with a certificate in family law. Please welcome with your virtual applause the Democratic leader of the House Minority Caucus, Amelia Sykes.
Hi, good evening. Thank you, Rick, for that introduction. Again, my name is Amelia Sykes, and I am privileged to represent Ohio's 34th House District, the birthplace of champions, and I'm honored to serve as the minority leader in the Ohio House of Representatives. Again, my many thanks to all of you for joining us this evening, as well as the League of Women Voters and NAACP for inviting me to be with you tonight to talk about a very important and a very personal topic, which is racism as a public health crisis. Conversations about race and racism are critical to building an understanding of the systemic issues we face and identifying solutions to improve the health, safety, and security of all Ohioans, particularly those who may be Black or Brown. Tonight, you'll hear a good, productive exchange of ideas and solutions, the kinds of conversations that need to be happening at the places of power where decisions are being made. I'm in my 4th term in the Ohio House, and I'm sad to tell you that these conversations are not happening at the State House. They're not happening in our committee hearing rooms, and they're certainly not happening at the Majority Caucus meetings. Let me be clear. Democrats want to have these conversations. Members of our caucus, myself included, have spoken up in committee and on the House floor to have these conversations. The result? Our members are gavelled down and ruled out of order. our colleagues across the aisle respond by saying their feelings are hurt or that they're being disrespected. But again, let me be clear, the only ones who are truly hurt are the millions of Black, Latina, Asian, and Indigenous Ohioans whose voices are not being heard in the places where decisions are being made. And I can assure you that the discomfort that they face talking about racism is nothing like being subjected to racism and racist treatment. And over the past year, we've seen this firsthand. Throughout the pandemic, state leaders have discounted the real consequences racial health disparities have in minority populations. And in the first few months of the pandemic, Black and Brown Ohioans and continue to see a disproportionate number of cases, hospitalizations, and death from the coronavirus. The interesting thing about a global pandemic is you can see in real time these disparities. Often we have to wait many years, sometimes decades to see them. This pandemic has made it clear as day. The testing rollout failed to prioritize communities of color. And now too is our vaccination rollout, failing to prioritize the people who need it most. We know the science, we have the data. And I've spoken with the governor on multiple occasions about these issues with his response. And my concerns are well documented in many ways, including in the press and in writing. And yet at every stage of this pandemic, it has been Ohio's communities of color who are most affected by scarce resource and misplaced priorities. The most vulnerable populations, those with the most risk associated with infection, should be prioritized. That's the fundamental principle of public health and epidemiology. But right now, white Ohioans are nearly twice as likely as Black Ohioans to have been vaccinated, and they are more than twice as likely than Latino Ohioans to be vaccinated. The lazy response is to say the disparity is primarily caused by vaccine hesitancy in minority communities, but it is not, because we know that white Republican men are the most skeptical and least likely to want to or to actually receive the vaccines. The disparities that we continue to see are direct results of structural and systemic racism in this country that have festered for generations. For years, Black people have been disproportionately hurt by the American healthcare system, being more likely than their white counterparts to be uninsured and suffer from chronic conditions that increase the risk of serious illness from the coronavirus. Add on to that, infant death, maternal mortality, cancer death rates, diabetes, hypertension, and asthma. I could go on, but we are looking for solutions since we know what the problem is. That is why the Ohio House Democrats have spoken clearly to declare that yes, racism is in fact a public health crisis. And why this route? Public health has been discussing this for decades, and it's been backed up with empirical studies from across the world. So it is not made up and it's not new, maybe just newer concepts to some who have not been familiar with this. So again, why is this resolution necessary? Because public health defines a public health crisis as one, a problem of large scale that impacts a large amount of people. Two, is a problem that is long-standing and persistent. And three, requires large structural solutions. This has been clear for a long time, but the disproportionate impact that COVID and many other health issues have had on communities of color should be enough to remove any doubt that some may have had with this issue. And again, I'm going to be very clear that racism, not race, is the risk factor. Exposure to racism puts people at risk of worse healthcare outcomes. And I'm going to say it again, racism and exposure to racism is the reason why people have worse health outcomes, not simply the color of one's skin, the way that they have been treated. More than 15 communities across Ohio have taken the step to declare racism a public health crisis, and with it begin to take real steps to dismantle systems that contribute to racial health disparities. It is important that we honestly discuss the social determinants of health, the conditions where people live, work, and play that affect their quality of life. Declaring racism a public health crisis is critical to a more comprehensive understanding of the issues facing the health, safety, and security of all Ohioans. But it also means committing ourselves and our state's resources to addressing the real challenges facing communities of color right here in Ohio. And while it's great that local communities are stepping up to lead the way on this issue, the fact remains that we need the state to step in, step up, and be a leading voice on this issue. We need a real commitment from the state in order to begin to address systemic inequities and injustices that are happening every day across our state. Passing the resolution to declare racism a public health crisis is just the first step to expanding the promise of health, security, and stability to all Ohioans. We know the systems that perpetrate these inequities weren't created overnight, nor will they be dismantled overnight. But we've got to start somewhere, and we've got to start now. But it's with discussions like this that we are having today and hope to have tomorrow and every day thereafter with our colleagues on both sides of the aisle that will move us forward to a more equitable future. So I encourage everyone listening today, not just to internalize this conversation, but to amplify it among your network so we can begin to dismantle systemic racism and build a society that renews the promise of better lives, brighter futures for all of us. Thank you very much.
Thank you for your passion. Thank you for your dedication. She will rejoin us later for the panel discussion. Our panel will actually include 4 women of note elected by various constituencies to positions of leadership in 3 different Northeast Ohio counties, besides State House Minority Leader Emilia Sykes, who will be joined by Cuyahoga County Council Member Shontel Brown, Akron Council President Margo Sommerville, and former Portage County Commissioner Kathleen Clyde. They will speak to us in that order. Now, Cuyahoga County Councilperson Shontel Brown is the next speaker this evening. After serving on the City Council in Warrensville Heights, she moved to representing the more than 100,000 people in District 9 of the county. Her goals include advocating for the needs of seniors and youth, and she wants to continue her work toward establishing a health and human services program that integrates economic development and promotes job opportunities. She earned her business management degree from Cuyahoga Community College. Please welcome Councilwoman Shontel Brown.
Thank you very much. Thank you very much, Mr. Jackson. So to follow all of the things that Leader Sykes were so critical to the intersectionality of racism, public health, government, healthcare systems, education, transportation, and housing. And so what kind of got me started along this work is our charter simply states, and I quote, the Cuyahoga County desires an improved focus on equity for all of our communities and citizens. So with that, I was motivated to declare racism as a public health crisis because for almost 400 years of history for Blacks in America, we've either been under slavery or Jim Crow laws, which has subjected Black people to tremendous hardships and disadvantages in all areas of life. The Center for Disease Control and Prevention states that public health is the science and art of preventing diseases, prolonging life, and promoting health through organized efforts and informed choices of society, organizations, public and private communities, and individuals. Additionally, structural racism creates a disparity between Black and white people in nearly all aspects of people's lives, but most importantly, again, healthcare, criminal justice system, healthy food, safe and affordable housing, well-paying jobs, quality transportation, education opportunities, and safe places to be active, resulting in adverse outcomes and shorter life expectancies among people of color, thus creating a public health crisis and areas of disparity between Black and white people. So for me, when we look at our population, Cuyahoga County is 1.2 million people, and the Black population represents 30.5, which equates to roughly 370,000 people. And given some of the challenges that we have faced around healthcare, including higher rates of disease, lower rate of healthcare access, shorter lifespans, and poor health conditions throughout the county, coupled with the American Medical Association and the American Psychological Association and the American Association of Family Physicians saying that experiencing racism can play a role in raising the risk of certain chronic health conditions in Black people. Black people are diagnosed with higher rates of diabetes, breast cancer, cardiovascular disease, asthma, all in which we have higher rates of diagnosis. In addition, these diseases have an endless number of health areas where Cuyahoga County is once reminded how Black people are disproportionately affected by these crises, and most recently with the COVID-19 statistics. with Black people representing only 30.5% of Cuyahoga County's population, but representing 40% of Cuyahoga County's COVID-19 diagnosis, and 45% of the admissions and 45% of the intensive care admissions related to COVID-19 in Cuyahoga County. These alarming statistics really were part of the catalyst to move the legislation to declare racism as a public health crisis here in Cuyahoga County. But I think it's important for people to know that COVID-19 was only amplified and elevated the conversation here in Cuyahoga County. This work actually began from the work that I started as a member of the advisory board of First Year Cleveland. First Year Cleveland addresses the infant mortality rate and maternal mortality rate here in Cleveland, Ohio. Sad to say, we have third world infant mortality rates in first-class hospitals. Those things just do not make sense. We started this work in 2016, meeting quarterly to discuss why these statistics were so drastic. And what we discovered is much of it was based on toxic stress, that much of it was stemmed from toxic stress that started from slavery. And this toxic stress has been passed down from generation to generation because of the systemic, institutional, and structural racist practice of, again, not having well-paying jobs, affordable healthcare, access to quality healthcare and affordable housing, all of the things that we're talking about today. These things created so much stress that regardless of a woman's education, if she were Black or where she lived, she still was more likely to unsuccessfully carry the child to term, even but compares to our white counterparts who may have much less education or much lower socioeconomic status. So as we evolved, as this conversation continued to evolve, the discussion around declaring racism as a public health crisis was presented to me in October 2019. And I will admit, at that time, I was a little bit, I had some trepidation because I knew that this was a sensitive topic, a difficult conversation would need to be had with my colleagues in order to see it through. Fast forward, January 2020, I started working with my staff to cultivate the language around declaring racism as a public health crisis. And I wanted it to be more than words on paper to make us feel good. I think for too long and too often, these are presented as symbolic gestures or signs of goodwill with no real action to put behind it, no real teeth. So unfortunately, the pandemic struck in March of 2020, but if there was such thing as a silver lining, it really amplified the disparities and the health disparities in the Black community. Following that, I hate to say, the tragic death of George Floyd also really amplified the conversation. People weren't able to turn away or dismiss the conversation. Many people were locked down and sheltered in place. So our executive also started to talk about this legislation, but I respectfully requested to take the lead and he followed suit because again, this needed to be more than words on paper. We needed to have some action tied to it. As other cities and municipalities were moving legislation across the finish line, my initial response and interest was much like the public. What do we do? What does it allow you to do? What does your legislation enable you to do as it relates to the community? And in having several conversations with people who had passed legislation, again, I wanted to make sure that ours was different. So what we decided to do was include statistical data. And that statistical data was more than anything, it was a little bit depressing. And at some point, I was almost hesitant to put it forward because it certainly didn't make me feel good. It was actually heartbreaking to see some of the statistical data around the disparities that we've been experiencing over the years. But what encouraged me to move forward with it is because it had to be said, it had to be documented, and it had to be in writing. Because at the end of the day, what I wanted to be able to do was to ensure that we would be able to receive the resources and the services to address the issues. So fast forward, having conversations with my colleagues, talking about some of the issues that needed to be addressed, I'm proud to say that even during some of these most volatile, divisive, and challenging, unprecedented times, I was able to get bipartisan support on this legislation, and it passed unanimously. Included in that legislation, I wanted to make sure that we had citizen participation. So the Citizens Advisory Council on Equity was included. And initially, this was going to be a group of people that would provide recommendations for us to evaluate our practices and evaluate recommendations on how we can make improvements within the county structure as well as outside of the county structure. Well, quickly, as Leader Sykes pointed out, this is something that has been going on for centuries. It didn't happen overnight, and we knew the problem wouldn't be resolved overnight. So we amended the legislation to ensure that this Council Advisory Committee on Equity would be in place for perpetuity. We need to continue to address these issues, and they would be advised to give us biannual updates on their progress and the recommendations and how we're moving forward. The other thing that I'll say about it is that we were very intentional to include a very aggressive timeline. Too often what happens with legislation like this is that it ends up sitting on the shelf. It's passed, people feel good, the conversation dies, and nothing happens. Well, to ensure that we got those results and those recommendations, I put an aggressive timeline of the end of 2020. And so we've already received our first set of recommendations from our Council Advisory Committee. So I'm pretty proud of that work as well. Finally, this is the type of work that is going to take more than just legislators. This is going to require public-private partnerships in order to really address this issue. If we do not have the support and allies to work alongside of us, then I don't see us really being able to move the ball forward. So I am pleased, privileged, humbled, and honored of the support that I was able to receive as it related to the Cuyahoga County legislation, as well as the participation from the public. And I look forward to having more fruitful discussions around this subject. Thank you.
Shontel, thank you so very much. Next to address us is Margo Sommerville, the president of the Akron City Council. She was appointed to office in 2013, replacing her father on that body, and has since won re-election. She has a Bachelor's of Science in Business Administration from Lincoln University and a Master's in Public Administration and Urban Studies from the University of Akron. She's a member of the Federated Democratic Women of Summit County, a life member of the NAACP Akron chapter, and a former board member for Keep Akron Beautiful and for East Akron Community House. Let us please welcome Margo Sommerville.
Thank you so much, Rick, for that wonderful introduction. Good evening. Again, my name is Margo Sommerville, president of Akron City Council. The city of Akron also declared racism a public health crisis, which really created a unique opportunity for us in the city of Akron to really look at how racism is being played out. As it relates to education in Akron, housing in Akron, our criminal justice system, and also even our healthcare system in Akron. And really giving us an opportunity to rethink things, rethink how we're doing things and really what we're doing in the city of Akron. And I will say the city of Akron really has stepped up in a major way. Again, we didn't just want to declare racism a public health crisis and just have it be a piece of paper. We really wanted to be meaningful. We really wanted to make some movement in this space. And so with the support of our mayor, Dan Horgan, we actually created a task force, right, that really is looking at these issues. And so people on this task force are community leaders, grassroots leaders, and individuals from the community. They're broke up into subgroups, really focusing on racism as it relates to education in Akron, racism as it relates to our criminal justice system in Akron. And they're having some really great conversations in terms of what are the issues? Where are the problems? And all of these subgroups are charged with actually bringing forth recommendations. And the city and city council are committed to really helping these subgroups actually make some of these recommendations happen. So we're excited about what the city of Akron is doing as it relates to our task force that is focusing on racism as a public health crisis in the city of Akron. As president of Akron City Council, I have really made it my mission, as long as I'm in the role of president, to really focus on racism as it relates to our criminal justice system in the city of Akron. And so I am extremely proud of what City Council has done and is currently doing in the space of police reform. You know, unfortunately, you know, we saw the tragic death of George Floyd happen. And in the city of Akron, you know, protesters, you know, they took to the streets and they marched and they protest. And so we began to really see and listen to them and say, hey, listen, we need to be looking at some things. You know, we're fortunate, really and truly, we have a great police force in the city of Akron. But what we must always remember is that we need to learn from others so that we don't find ourselves making those same mistakes. And so what we immediately did was we put in a no chokehold ban in the city of Akron. We didn't have anything on the books. So for example, if in fact a police officer had put someone in a chokehold that restricted, you know, wind, causing them to pass, you know, not necessarily the officer would be held criminally liable. So we put in a no chokehold ban. Not only did we put in a no chokehold ban, we put in it that it's mandatory to intervene. Mandatory to report. So officers can't just stand around and look, you know, when you see something, say something. When you know something's not right, intervene. And when you don't do that, now because of that legislation, we will hold police officers criminally liable. Again, it's all about making sure that our police officers are held accountable and are being held to an extremely high standard in the city of Akron. So that's important. And so we were excited about that piece of work, but it didn't stop there for us. And so we continued these conversations. Again, we were listening to those who were marching the streets of Akron saying that police reform is important, transparency and accountability is needed. And so what we decided was we were going to change our charter. We know that accountability and transparency is important. You know, council put in a lot of money to make sure that our police officers wear body cam footage. But the issue we had is that taxpayers paid for body cam footage, but they couldn't see the footage. That was a problem. And so what we decided to do is put it on the ballot, allow for the Akron voters to decide, is it important for them to be able to see body cam footage? And so we did just that. We put a charter change on the ballot, asking Akron residents if it's important for them to see body cam footage, but not just any type of body cam footage, right? We're really interested in body cam footage where there is abusive use of force, right? And so we put that on the ballot. Akron voters responded overwhelmingly, and our charter change passed. And so we're currently working on legislation right now so that we can make sure whenever there is use of force happening in the city of Akron, you know, the public has a right to see that body cam footage. And it's a way for us as the city and city leaders to say, hey, listen, we're not hiding anything, right? We're going to show you so that you can see it for yourself. And then we're going to go through the appropriate course of action to make sure that we investigate the situation. And so we're excited about that work too. But again, it doesn't stop there. We also are doing what we call reimagining public safety in the city of Akron. For the very first time in history, we brought all of Akron City Council members together to work on this initiative. We divided council up into 4 working groups: police accountability and transparency, crime prevention, personnel and culture, technology and equipment. And we actually held about 22 meetings and brought forth some really great recommendations that, you know, all of us of councils are proud of. And I think the rest of the city is also proud of. But I think it was important for us as legislators to really take a deep dive and do some fact finding to really engage with our Akron police officers to learn about what it is that we're doing. ask questions, and celebrate our successes, but really look for ways and areas that we need to improve. And so we've done that. And some of those recommendations coming out of Akron City Council's Reimagining public safety were really strengthening the role of our police auditor. We currently have a police auditor that has no power, who has no staff, who has no access. And so really looking at how we can empower that position and how we can supply that position with the access that it needs. Another recommendation that came out of our reimagining process is creating a pathway to policing. For us, it's very important. We want to make sure that our police force is diverse. You know, we want to make sure that, you know, our police force is representative of our city. And so, again, we're really excited about the work that City Council is doing. We are going to continue to engage in our process. We're currently also engaging our public. We've partnered with the University of Akron because we want to now hear from the residents of Akron. You know, these are council's recommendations, but we want to know, have we missed something? Is there something more that we need to look at? And so we're excited as we continue to do this work. We're having conversations. You know, sometimes these conversations are not the easiest conversations to have, but they're the very necessary conversations to have. And so I look forward to continuing the conversation on tonight.
Margo, thank you so much, and we will dig into some of those topics that you have mentioned as we get to the roundtable. Before we do that, though, our fourth presenter is the former Portage County Commissioner and former member of the Ohio House of Representatives, Kathleen Clyde. She was also director of the Early Voting Center in Franklin County for a time and remains active in voting rights issues. Ms. Clyde is a graduate of Wesleyan University and the Moritz College of Law at Ohio State. She was appointed County Commissioner of Portage County in 2018 and later served as one of the keynote speakers at the 2020 Democratic National Convention. Please welcome Kathleen Clyde.
Thank you so much, Rick. It's such an honor to be here, and especially with these incredible women leaders that we have in our state, in our cities, county, and boy, are we lucky to have our minority leader fighting for us for change for all Ohioans, which she's so right. It's such an uphill battle. A lot of just smart, good advocacy falls on deaf ears because of the gerrymandering in Columbus that makes our state house an unfair fight. So I'm just glad to be with all of these amazing leaders. I'll say that I first thought of racism as a public health crisis by seeing my friend, House Minority Leader Emilia Sykes's tweet. So let's not say that our social media and the work we do amplifying each other doesn't make a difference. Because that is what got through to me. I saw a tweet from Representative Sykes, and she was commending another colleague of ours, County Commissioner Kevin Boyce from Franklin County, who really led a groundbreaking resolution in the state of Ohio to declare racism a public health crisis in, I believe, our largest county in Ohio, or maybe our second largest county in Ohio. And when she called that out, I looked into what he had done and was really proud to know him, glad that Amelia was amplifying that. And it just really got me to think about it in a new way. Then the pandemic hit, and I was the president of our Board of Commissioners in Portage County, and we were just trying to deal with a huge public health crisis, basically at the local level, with an absence of leadership from the White House. And on the national level, local leaders were really on the front lines. And while our state leaders in the beginning I think had some strong moments. As Leader Sykes pointed out, there have been the response more recently really has been lacking, especially for Black and Brown communities in Ohio and communities of color. And we were seeing that early on in the pandemic, again, in part because of our amazing Black leaders around the state who are amplifying the issue and talking about this pandemic is not hitting everyone equally. We are seeing a higher death rate in our Black communities, in our minority communities, and we are seeing a higher infection rate. And our essential workers are out and they are not protected. And hearing their concerns brought the issue to my attention again. We thought about the racism as a public health crisis work that had come out before, and that's when we really got to work on trying to spotlight our own racism as a public health crisis in Portage County. We based our resolution off of Franklin County's resolution in Portage County. So that's always helpful when you don't have to, you don't have to reinvent the wheel, and you can look at the work that they have done. And so I tracked that down. One of the things that was helpful in Franklin County is their health department had worked jointly with them. And in our case, our health department, again, they were hit very hard by dealing with the pandemic. So we used some of the data that they had been putting out in the community, but they did not join with us in our declaration. But some Portage County groups did. The city of Kent declared racism a public health crisis. The Portage County Mental Health and Recovery Board, with the leadership of Frank Harrison, a Black leader in Portage County and NAACP leader. So we had some leadership around the state, Kevin, other counties, other cities, and we worked to follow suit. One of the things that was really important for us too was highlighting that this isn't just an issue you read about in cities in Ohio or someplace else. There are major disparities right here in Portage County. So it's not a someplace else or an other people's problem. It is a problem right here. And we highlighted those right in our resolution so that we kept it very close to, look, this is data driven. The facts are right here. We cannot ignore them. So looking at the institutional racism in Portage County that fuels this, Portage County's Black residents experience dramatically higher unemployment rates. The overall unemployment rate, this was leading into COVID, was 6.3%, but the Black unemployment rate in Portage County is close to 12%. Also, the poverty rate. As a community, our poverty rate is much too high. For sure. And our overall poverty rate in Portage County is 13%. Among our Black community in Portage County, it is 28%. That's unacceptable. That is institutional racism that is an underlying factor for why we had to declare racism a public health crisis. We also look at residential segregation and the effect that has had in our communities. Home ownership rates in Portage County. The overall rate of people who own their own home is 70% in Portage County. How many in our Black community in Portage County own their own home? Only 26%. So those big disparities, that institutional racism, the evidence is right there. You can't say it doesn't exist. You can't ignore it. That type of institutional racism leads into the public health crisis, the racism as a public health crisis. And then we got into talking about the healthcare outcomes, that a Black man in Portage County has 141% greater risk of being diagnosed with prostate cancer than a white male. that a Black woman giving birth here in Portage County is 48% more likely to receive inadequate prenatal care than a white woman. And Black women in Portage County are 193% more likely to give birth to a low birth weight baby than a white woman is. And finally, a non-white infant was 148% more likely to die before their first birthday than a white infant. This is simply unacceptable. This is unacceptable, and this information helped lead us to make this declaration. Like the other women before me talked about, we didn't want to just state the problem and not have any action. So right in our resolution, we talked about the policies that we wanted to enact. We didn't want to, as a Board of Commissioners, every meeting that we have, we adopt new policies. We spend budget dollars. And with every policy decision that we make, we want to make sure that we were promoting equity through all the policies that we approve, and that we are working to enhance educational efforts aimed at understanding, addressing, and dismantling racism and how it affects the delivery of health and human services, which is a key function of your county government. We said in our resolution that we want to continue to advocate locally and through our state organization. The county commissioners lead the county, but they also come together with all 88 county leaders to advocate at the state level. So to help back up what Leader Sykes is trying to do in the State House, we want to fight for that as counties together. And then also fighting on the federal level. Counties have an important voice there. So how can we be fighting for those budget dollars, be fighting for the data that we need and the work that we need to dismantle racism? We talked about in our resolution further solidifying alliances and partnerships with other organizations that we work with to confront racism and encourage other entities to recognize racism as a public health crisis. We want to support community efforts to amplify issues of racism and engage actively and authentically with communities of color wherever they live. We want to always promote and support policies that prioritize the health of all people, especially people of color. And we worked to implement ongoing racial equity training with the goal of reaching all of the staff in all of our county departments that fall under the Board of Commissioners, and then encouraging that racial equity training, including components about racism as a public health crisis, to other county elected officials and agencies, to encourage them, make that available to them, and then encourage them to implement it. So these were clear goals and objectives that we identified as part of our resolution. You know, some of the facts are just startling. And I was reading today as I was thinking about what I wanted to say, and a stat came before me that every 7 minutes, a Black person dies prematurely in the United States, does not live to their full life expectancy, which again is shorter than a white American. And that's at every level of education. And I think Councilwoman Brown mentioned this early on, but the life expectancy gap. A Black college graduate on average does not live as long as a white high school graduate. Again, because of these disparities, and they are at every level of education and income. So because of this bias, fueled by structural racism, fueled by institutional racism, that is the root cause of these disparities in our healthcare system. And it's not just a problem, it is a failure. It is a failure of leadership and of our ability to address and really get at the root of this problem and dismantle the racism and deal with people's lives, their very healthcare, their ability to achieve their life expectancy. we all need to be fighting for this. And I'm glad that on September 10th, 2020, Portage County declared racism a public health crisis, following in the footsteps of some amazing leaders like you already heard from. And I look forward to getting to discuss this more with each of you as we talk about how we can do this in more communities and really push for this at the state level, like Leader Sykes brought up at the beginning.
Kathleen, thank you. Thank you for batting cleanup. I almost want to just sit for a second and let people digest those numbers you threw at us. Truly amazing. Thank you to all of you. Wonderful setup to the roundtable conversation we will now have for the next 20 minutes or so. The five of us will engage in further talk about racism as a public health crisis. And if perhaps you joined us late, the guests are elected officials representing a county, two counties actually, a city and the state. Amelia Sykes of the House of Representatives, Shontel Brown of the Cuyahoga County Council, City Council President Margo Sommerville of the City of Akron, and former State Rep and Portage County Commissioner Kathleen Clyde. So to begin, we know that acknowledging racism as the underlying cause of health disparities not only puts a name to the problem, but it creates an avenue to hold leadership accountable. Margo Sommerville, let's give our viewers something to chew on. How should they go about holding leadership accountable? What steps do we take?
I think that's a great question. I mean, I always encourage residents, first, please get involved. We hold, it's COVID now, so it's a little bit different. Council meetings are held via Zoom, but still, get online, see exactly what's happening, what conversations are happening on city council, ask questions. Call, I mean, we want you to be engaged. We want to hear, from you. I think the one thing that I want, listeners to understand, again, a lot of the work that we did around criminal justice reform was really things that we heard from residents at protesting, right? So, I mean, I think that, just want to encourage residents to know that, us as elected officials, we hear you. And we want to hear from you, and we need to hear from you. And we want you to be engaged.
Shontel, I know you're just chomping on the bit to jump in on that. How do we hold you accountable?
Thank you, Rick, and I agree. I agree with the council president in Akron, Ms. Somerville. I like to always borrow a quote from Senator Cory Booker, who says, "Change doesn't come from government; it comes to government." And it's so important that we have citizens' participation in helping us shape our policies. We are elected to represent the people. And so it is very critical that they engage with us and share their concerns. And outside of that, I think we also, with the legislation that was drafted in Cuyahoga County, I was very intentional to include metrics and measurements and statistical data for us to start from so that we could be held accountable. And so that long after I'm gone, or long after, the next set of council people or county executives arrive, they will have a document to be able to measure and see where we are now and where we are in the future. And so providing those type of measurements, or providing those type of mile markers, if you will, is essential to holding people accountable. I think we should be able to see the changes in our conditions. If we are increasing home ownership, if we are expanding that life expectancy, if we are reducing the economic wealth gap, if we are promoting more children to graduate and increasing that education level, those are the things that we can look to as it relates to the work that we're doing around racism as a public health crisis. Additionally, I applaud the efforts and initiatives that came out of Akron around criminal justice reform. I too have been working on a project here at the county around legislation that deals with crisis assistance helping out on the streets, CAHOOTS for short, where low-level offenses, if you will, would not lead people, particularly people who might be suffering from mental health, drug addiction, homelessness into the system, which would inevitably create a cycle for a more challenging cycle for them to advance and become productive citizens. What Cahoots would implement is a fourth option. If you were to call 911, instead of police, fire, or ambulance, it would also include crisis intervention. Many of the statistical data around racism includes behavioral health issues. Again, dealing with the stress, drug abuse is high, mental and emotional health issues are higher in our community. So being able to provide real life strategies and policies to deal with these issues on the front end are other ways that people could continue to hold us accountable. So those are just a few things that I think would be helpful to answer that question. But again, I can't help but bring it back to Senator Booker. Good change doesn't come from government, it comes to government. So please participate in the process so that we can continue to champion policies that are important to the people that we are represented to serve.
Thank you. We invite all of those listening and watching to add your own questions. I already have a bunch that have come in already. Let me start with this one. Leader Sykes, I'll throw this at you. The speakers make the point that these resolutions need to be followed by action. How does a declaration that racism is a public health crisis create a threshold of action to address the institutional racism that affects our Black and brown citizens across Ohio?
So that question is a little bit more difficult to answer because it's completely dependent upon which government body is introducing it. And resolutions have different meanings at different places. So for example, a resolution in the General Assembly is not particularly, doesn't have a lot of teeth in it, but what it does do is it helps us create a framework and a baseline from which we can all work, helping us to make definitions, to list out goals, to identify the problem and speak to it. Because one of the problems that we have at the state level is that there are people who are just active deniers. I've heard Councilwoman Brown talk about the data and the metrics and wanting to have something tangible to show people. Unfortunately, those types of things are not worthy of consideration with my colleagues because as you all have seen with the COVID pandemic, politics reigns supreme. I had read an article from the editor of the Health Affairs, and he made a quote that I read on the House floor one day that did not go over well with my colleagues. But essentially, he said that racism is just one of the many tools that people use in order to stay in power. And so the reason why we continue to see, or we don't see the change that we want to, is because that's how some people stay in power. That's how we get gerrymandering. That's how we get voter suppression laws. That's how we have inequality, so people are not able to move up the economic ladder. So they don't have the ability or the time or the desire to vote in or out people who are not doing things in their best interests. And so, you know, these resolutions at each level will do and can do and create different things, but it really is up to the body and the members to create those actionable steps. But again, all that starts with the people in our states and in our communities who are either electing or not electing folks who believe in those types of issues and continue to hold them accountable, either through voting, through letter writing campaigns, through phone calls, through showing up at town halls, and all the other things that we need to do in order to push elected officials to make these resolutions powerful and meaningful in our communities.
You just touched on answers for about 6 different questions that have come in from viewers there. One that I did want that came in quickly at the top as you were speaking earlier was, are there any Republicans at all that are joining with you in this work in the legislature?
No, not one, 0.
Okay, that was a much quicker answer than I expected, but unfortunately it is the answer I expected. Kathleen, Clyde, you lead the charge for the declaration in Portage County. You laid out some incredible numbers for us earlier, but the county is demographically 95% white. Do you fight a different kind of battle than Shontel or Margo would fight because of some people's perception that really massive systemic racism can't happen because you don't have a large minority population?
I think the fight is different, but part of the fight is that we're all in this together, and I feel like white people need to stand up and support Black leaders and and acknowledge our own biases and our own role in dismantling racism, addressing it, calling it out, whether it's in Cuyahoga County or Portage County. I think that the politics are different in Portage County. Sure, the population is different, but that's why I went to so much effort to make sure I addressed the problem, and I wasn't taking Franklin County's resolution and just, deleting Franklin and putting in Portage. But I had our information, and the disparities in some of the cases compared to Franklin County, the disparities were greater. The numbers are a lot smaller, yes, but those Black residents in Portage County are just as important in Ohio as the Black residents of Summit County and Cuyahoga County. I'm sure my colleagues here would agree with that. So I was proud to stand up for them. And I want to just echo what Leader Sykes said. At the time in Portage County that I was serving as a commissioner, the commission was 2-1, 2 Democrats, 1 Republican, and the Republican did not support our resolution declaring racism a public health crisis. I'm surprised to hear that Shontel had some support, but I think that's good. It's good when you're in power, you can actually move the resolution, and then you can hold your Republican colleagues to a vote and see where they stand. Where often in Columbus, they won't even bring things up for a vote. So you know where they stand, but you don't have that no vote in front of you to get frustrated about or show people. It's a little less tangible that way. So it wasn't actually a no vote, it was an abstention, which I think us elected leaders know is like a big giant eye roll. But the commission flipped. I did not win re-election. It's now a 2-1 commission. So the politics here are tough. And I hope that, we continue. This resolution still passed. It's still official. So we need to hold the current commission accountable for what was declared that day.
Thanks. Margo, Somerville, I'm going to combine some questions here. One part is, how can we engage the privileged populations in Summit and Cuyahoga counties in this journey? Another ask, wondering if the big population problem is that white populations have to be aware of and acknowledge the problem, including how they contribute to it on an ongoing basis. And the questionnaire wants to know, how do we address this reality?
Yeah, that's a good question. One of the things that we realized, in the city of Akron, us as legislators, we probably are not the best, right, as politicians to be going out and maybe having conversations with the public, on this topic. And so that's why we partnered with the University of Akron. And so we're engaged right now in having focus groups. Anyone can sign up and be a part of these focus groups. So we're really doing a deeper dive and really having some of these conversations one-on-one with residents. And so students are helping us in this process. Students are leading these conversations as we're trying to really figure out what racism, means to residents and, some of the things that they're facing in their neighborhoods and in their communities. And so we're going along that rate, that route, having the university to kind of help us have these conversations. And again, they're difficult conversations, but they're conversations that we must have. So we're hoping through that process, we'll be able to hear, many voices from all over the city of Akron.
Thank you. Amelia, Sykes, again, I'm combining some questions here, so hang with me as I'm kind of improvising. Given that it's proven by several health organizations that racial abuse does take a toll on community mental health, it's directly linked to overall health. One, are we falling behind in this race to equity? And two, questioner wants to know how Ohio's Department of Health is being used to address the public health crisis, and can that be improved?
Great job putting those questions together. So the racial abuse that you talk about is often we use a term in public health called weathering, and you think about your boots or your home, and when bad weather happens, or your tires or the rest, it starts to wear at it, it starts to rust, it degrades, disintegrates sometime. And that toxic stress from racism, that what happens to your car, what happens to your boots is what happens to our bodies. And so I want to use that imagery so you understand how real it is, and the impact, because you've seen those cars in Ohio with giant rust holes in it, and you think, how are they even driving? And that's what you should look at when you see your fellow Black friends and family. How are they even smiling? How are they making it day to day? And sometimes it's just barely. And to answer the previous question that you had, be willing to have a little empathy and think through that as you are going through the world, that you don't have a giant rust hole in your heart because of the weathering effects that racism has. And think about what that does to a person over a long period of time, or to an infant who is trying to survive and thrive in the womb. They are not surviving, they are not thriving, and that's why our infant mortality is so high. And so that's the answer to the first part of the question. But what is the Ohio Department of Health doing? Not much. And I hate to be so, well, I don't hate to be so blunt, but I need you all to understand the reality of the problem here, because we went from a health director who understood and appreciated public health and racial disparities, to now we have a health director who does not. And while I don't want to say someone doesn't care without having had that person tell me very clearly, but as someone who has assessed public health and understands it, I can tell from the actions that it's just not there. We, as members of the Ohio Legislative Black Caucus, which is a group of Black legislators who represent communities across the state, and not all of them are majority Black communities, have talked to the governor, for example, over and over and over about declaring racism as a public health crisis, or even just saying those words. And it took a very long time for that to even get to be a point, because it was all political. There were political points to be scored with refusing to acknowledge that people are dying, that people have rust holes in their hearts. People want to maintain that power, and they are willing to allow racism to persist, to stay in power. Meanwhile, we have hundreds of thousands, millions of Ohioans with rusted out holes in their hearts and their bodies because they have been weathered through racism, and they come from policies like the Department of Health, who has historically done things like fail to make access to abortion care reality because of politics, or refuse to truly put forth a racial equity plan. One of the things that the governor did was create a position around racial equity, but it was, a very symbolic gesture, because there has already been a racial equity department. And I've spoken with those people, and we have a commission on minority health, but that's not who they wanted to hear from. They wanted to hear from someone within their ranks who would be more in line with their politics, not with the commission on minority health, not with the existing staff, with people who they could get along with better and would not create issues, because it is radical. And I say radical, root cause type of issues to declare racism as a public health crisis and dismantle it. And some people just are not ready to do that. And politically, it is not to the advantage of others, because they lose positions. And I hate to call out Kathleen on this one, but when you dare to stand up for people, when you dare to say this is not acceptable, unfortunately, there are people who say, well, we don't want your kind of leadership. I thank goodness for people like Kathleen Clyde all the time, because without her and people like her, we would be much worse off. But the problem becomes when she leaves office, there's someone else who's not like her who is now making those decisions. And so I just want to say to you, Kathleen, publicly, because I know that was probably one of those things that was problematic in your election. Thank you for doing that. We really appreciate you having the courage and the bravery to do such a thing, knowing that it could cost you personally and professionally, but that is what we need people to do, to step up and stand up to racism in all of its form, to help all Ohioans.
Thank you. So if I follow you here, the score is State Board of Health doesn't seem to care. Portage County Board of Health didn't really want to talk. Shontel, what you got? What's Cuyahoga doing?
I'm proud to say Director Allen has been very much engaged in conversations around declaring racism as a public health crisis, and not only conversations, but taking the lead, so, participating in the advisory board around the First Year Cleveland initiative that we put forth that really started our legislation again in 2019. These issues require again, leaders that are willing to speak truth to power, leaders that understand that you have to have allies. And Director Allen has definitely been an ally and a champion here in Cuyahoga County, and one of the thought leaders on this issue, and helping us shape some of the narratives and some of the efforts around addressing not only First Year Cleveland, but how we're approaching vaccination and regular and reliable COVID-19 testing. So I guess I count myself as very fortunate and very blessed to not have the challenges that my sisters are dealing with in Portage and at the state level. But I think it's important to point out again how incredibly prevalent how incredibly prevalent the racism, the institutional, that is institutional, structural, and systemic racism at its best. That is it on its very face. And the challenge that we deal with too often, I think there's a quote that privilege is when you think something is not a problem because it's not a problem to you personally. And so the acknowledgement that we get from Kathleen Clyde is greatly appreciated in that allyship, and also her willingness to not back away from the reality of the situation. So confronting these issues and having uncomfortable conversations at times is the order of the day. I think I'm going to take a liberty and say I think I can speak for all the Black women on this call. We are very comfortable having uncomfortable conversations because that is the life in the daily, the day-to-day activities in which we live. Oftentimes we are the only ones in the room that look like us. And so, so it is not out of the ordinary for us to have uncomfortable dialogue, but when other people are uncomfortable with it, then those conversations start to fade to the background, or you're described as being confrontational or aggressive. No, what we are is presenting a real issue that needs to be addressed, and we should not ignore it. Earlier on the program this morning when we spoke, I talked about racism in comparison to cancer, and that's often how I try to use that analogy when trying to educate or inform a person who has never experienced it, and especially if they're being called out on it. If you're being called out, don't take it as a personal attack, just like you wouldn't take being diagnosed with cancer as a personal attack. You might feel bad about it, but what you would do is you would try to find every tool in your arsenal to try to eradicate the cancer. And that's how we should be treating racism. When it is diagnosed, when it is brought to our attention, then we need to not back away from it or run away from it. We need to confront it and do everything we can within our power to eradicate it.
Thank you. When she references our talking this morning, she and Leader Sykes joined me on the Sound of Ideas on 90.3. Same topic, very different conversation. So you can go to ideastream.org if you want to hear more about that. Last question we're going to throw at you tonight because they're telling me we're running short on time. And it's something we touched on earlier. Amelia Sykes, they want to know, how do we dismantle the unfair power dynamic of gerrymandering across Ohio? And I know you could do an hour, but just in a couple of minutes.
But I won't. So first of all, Ohio voters, with the help of Illegal Women Voters, NAACP, and many other groups, were able to get past two constitutional amendments that will reassess and completely revamp the way that we draw our state legislative and congressional districts. And we are going through that process right now. At least we should be going through that process right now. Unfortunately, we are being held back because of some census delays that started with the Trump administration and all of the racist policies that they were implicating with check boxes for undocumented immigrants and failure to fund it. And then because COVID did not make anyone's life better, we are delayed in that process. But one thing I would suggest that people do is that as we are trying to figure out these lines is to stay engaged. And while I welcome all calls, all texts, all emails, all phone calls and such, reach out to those who have so much more to lose in the event that we have fair districts. And I'll make it really plain, the Republicans. They do not want to start this process. They have been dragging their feet. I currently co-chair a task force that has $5 million in the bank. It's been there for over 2 years now, that is not being appropriated to the rightful parties in order to start this work, especially knowing that we are being delayed. And I've been asking for this for well over a year now. We are being held up in this process right now because I'm confident, I can't say with certainty, I'm confident though, that again, holding on to power, which is ultimately the goal of what gerrymandering is, and again, protecting racism, which ultimately allows for these types of things to act in perpetuity, is going on, and they need to be addressed and talked to and feel the pressure from all of us. Over 70% of voters across the state on both of those constitutional amendments supported it. And so they need to hear from the 70% of people who want to, who are ready to see the legislature and the redistricting commission make due on that promise. So please engage, please reach out whenever there are public opportunities for hearings, which is in the constitutional amendments. Please show up, bring your friends, bring your children, participate in some of the online map drawings so you can see exactly how it works and how you can manipulate the data and the maps and people to make it do what you want it to do and get the type of community profile to put it a certain type of elected official. It'll all start to make sense. And then something that is as wonky and sometimes lame as gerrymandering will become very interesting. And then we'll have much more civic participation and hopefully a better outcome.
Thank you for putting a bow on that. That was great. That unfortunately is all the time we have allotted for this segment, though we could easily do probably another 40 minutes to an hour. I would certainly like to thank the panelists for their contributions, their honest assessments, and the force of their arguments. Kathleen Clyde of Portage County, Shontel Brown of the Cuyahoga County Council, Margo Sommerville of the Akron City Council, Amelia Sykes of the Ohio House of Representatives. Thanks to each of you. Again, to our viewers, all this information will be forwarded along after the session's end, as will the list of resources on screen. Now, here to tell you specifically what you can do and to offer more about those resources is Sally Saltzman, the Diversity Program Chair for the League of Women Voters, Kent.
Thank you, Rick. Realizing and recognizing racism as a cause of health equity disparity is only our first step in ensuring all citizens have access to quality health care. In order to make real change to address the disparity, we must use the health equity lens on all public policy legislation, whether at the federal, state, county, or local level. The League of Women Voters of Ohio position on health equity calls for legislation that would act as a means of assessing all proposed legislation as to its impact on health equities prior to adoption. The resolution we heard about tonight, HCR 6 and SCR 4, advance the League's position and call for the following actions: establishing a glossary of terms and definitions concerning racism and health equity, asserting that racism is a public health crisis affecting our entire community, expanding understanding of racism and how it affects individual and population health, committing to refute codified ordinances with a racial equity lens, and committing committing to conduct all human resources, vendor selection, and grant management activities with a racial equity lens, as well as securing adequate resources to successfully accomplish the above activities. Please click on the link in the chat box to immediately send a message to your legislature to let them know you support HCR 6 and SCR 4. And now a few words about virtual testimony. The fight for all voices to be heard in our democracy will not be over once the general public is vaccinated and the country has achieved herd immunity. Whether due to physical health constraints, work obligations, logistical challenges, or family responsibilities, there are voices not heard in the Ohio State House. For these reasons, it is essential that the Ohio State House allow virtual testimony. If 2020 taught us anything, it is that the country can operate virtually effectively. The Ohio State House should be able to also. Please click on the link in the chat box to immediately send a message to your legislature to let them know you support virtual testimony. Now, here is the list of resources referenced in tonight's discussion. You'll receive this list as part of our follow-up email to all participants tomorrow. And finally, a few words about the League of Women Voters and our partners. Have you liked what you've learned during the Real Talk series? Are you interested in getting involved to ensure equity, civil rights, and democracy are realized for all Americans? Consider joining the League of Women Voters and our incredible program partners. Tonight's program was hosted by the Akron, Greater Cleveland, Hudson, and Kent Leagues in partnership with the Akron NAACP, WKSU, the Freedom Bloc, and IdeaStream. Visit these websites for more information about who we are, what we do, and how you can get involved. Thank you to Rick Jackson, our wonderful panelists, and you for being part of this important conversation.
And thank you, Sally. And that is our program for this evening. Once again, I thank the panel. We invite you to tune in again next week. My colleague, Marlene Harris-Taylor, will moderate another great discussion. Again, that request to examine the growing problem of racism, whether it's against African-American, Asian American, Native American, or Latinx residents through a public health lens. What hurts one of us ultimately hurts all of us. I'm Rick Jackson of IdeaStream. Thanks for coming along and have a great night.